Hi, my name is Dr. Carl Trosdale, and I am a double board certified facial plastic surgeon, and I work in Beverly Hills, California. I perform facelifts, rhinoplasties, eyelid surgery, and much more. My job is one as an entrepreneur, a businessman, a husband, a father, but a surgeon who gets to transform patients' lives. Beyond the surface to me means the transformation and the journey that my patients go through. It's not about the external, it's not about the facade, it's not superficial. We are going to dive in to what makes my patients tick, a little bit about my life, and all the drama of owning and operating a practice in Beverly Hills, California. It's plastic surgery, but it's so much more. If we're lucky, we age, right? So we're gonna get older, and that age shows it on our face. We, on the inside, we're a spirit, we're a person. We wanna feel young. We see what we look like in the mirror, but it might not match how we actually feel on the inside. The beauty about what I'm able to do is align how we feel on the inside and what the mirror shows us.
Come in.
Hey.
Hi.
Good to see you again.
Good to see you. My name is Jessica Buck. I am 47 years old. I am traveling from Troy, Pennsylvania.
Yeah, so it was really cool meeting you guys when you came with Kiane.
Yeah.
And you didn't tell me the whole time that you were thinking about
I was,
this.
and
I'm like, why didn't she say something?
I know, I should have. Like, I was like, the whole time, I was like, well, this is their family time. I didn't want to take from that.
Did you know?
She knew. She heard about me talking about my neck all the time. She knew that I wanted to, but I was like, I'll wait and see, like, and then those, like I said, those videos started rolling in about, you know, just the transformations. And I was like, because it's a big decision.
It's a huge decision.
I don't want to just put it in the hands of anybody. You know?
Well, the good thing is you got to meet me.
Yes.
And you know my whole family and everything.
I knew how you were in the family setting, which was awesome. And that dinner was so much fun. The family style. Like,
Jessica is 47 years young and is from Pennsylvania. She's from a small town named Troy. And so I've been to this small town because I'm from a small town in upstate New York, actually not that far from where she's from. We met actually by happenstance here in Los Angeles. My nephew was doing some modeling here in LA, and so he brought his girlfriend and his girlfriend's mom. His girlfriend's mom is Jessica. So we had dinner together, we ate out in Los Angeles, we showed them around, and we went to the fashion show. Come to find out, her mom, my nephew's girlfriend's mother, wanted to have a facelift, but she didn't bring it up the entire time. Well, today, let's review the plan. Tomorrow, you're gonna be about 20 years younger. It's gonna be amazing. So even though facial plastic surgery is like outside, right? There's so much, the journey, the inside, the outside, they go together.
Yeah.
So I'm excited for your healing.
Yeah.
Not just the healing,
no,
but the healing.
But the healing.
It's gonna be great.
Because it's like my final step.
Yeah.
I'm feeling great on the inside now. I knew that at some point I was gonna do this. I had been suffering from anxiety and depression for years, for about 5 years actually. And I let it take its toll. I was in a relationship where the other person didn't really believed in that kind of stuff. And unfortunately, I didn't get help. So I'd lay in bed and I'd shake, and it puts a toll on you. And I was stressed out about getting older, and that didn't help. I woke up one day and I looked in the mirror, and it had all changed.
You've been concerned about your neck, right? We're gonna take care of this. So some of this is loose skin, some of this is loose muscle, and some of this is fat, but we're gonna snatch you up. Basically, this all is coming like this. So your jawline, you're gonna be dueling jawlines. Same jawline, that's what we're going for.
It's been amazing because she watched, you know, the journey that I went through and the pain, and you hate to have your child have to see that, you know? You want to be their biggest support, and so, but she has just been phenomenal for me and been my biggest like champion, saying, let's do it, you got this, like. But, you know, the depression, the anxiety, like, it took so many years away. It's heartbreaking to know that there's many other people. I mean, obviously I'm not the only person in the world that goes through those things. But I don't know, I don't ever want to have to feel that way again. And I know the steps I have to make now, that mental health is one of the most important things we can do to take care of ourselves.
So basically this is gonna come up really nice and tight. I'm gonna tighten up those muscles. You're gonna see that day one. So I'll take some photos of you while you're on the table. I'll send them to you. You'll be able to see immediately.
Yeah.
This is gonna be amazing.
And like now, this area bothers, will that?
Let's go up. So the next step is lifting the face, right? So all of this jowly stuff, the cheek, the fold, that all comes up. So you've been feeling depressed, you've been feeling down. We're gonna turn that frown upside down.
Like, I'm ready.
Literally. A deep plane facelift is my standard approach to lifting the face. It is different than other types of facelifts because it's more comprehensive. When I do this surgery, I'm under the muscle, under the layer of the muscle, and I'm releasing everything so that I can move that sheet of muscle back to where it was 20 years ago. This lends to a very natural result, one that has minimal downtime, minimal bruising, and people never look stretched, they never look pulled, none of that weird stigmata of surgery. They just look refreshed, like themselves, and rejuvenated. We talked about adding some fat, right?
Yeah.
So basically I'm gonna steal some fat from either your thigh or your belly. We'll look here in a second. But the areas that need that volume for you, a little bit in the cheek. You okay?
Yeah.
A little bit in the cheek area, right? In the under eye area, this area along your jawbone.
Yeah.
Turn towards me. Maybe a little bit in your temples too. Just a little bit, not too much.
Yeah.
I don't want to make you like a, bobblehead. My family has been everything to my success. I could not do this without their diligent support because when I have a hard day, when things are tough, those are the people who I call. Those are the people that I lean on. When I have a clinical question, right, I might call a mentor. I might figure out what does the literature say. But there's really no answer for what is it truly like to feel alone. When no one else understands what you're going through, I lean on my wife because she's been able to see me grow from a first-year medical student to a resident, to a chief resident, to a fellow, now a practice owner. She's seen the hard days where I've come home and I'm completely exhausted. She's seen those days when maybe in the hospital my patient didn't have a great outcome. She's seen days where maybe we just had a huge success and look at this before and after. I remember the first time that I did my own independent surgery and I called her up. I remember when I passed my MCAT and I got a great score and I told her, listen, I'm gonna be able to be a head and neck surgeon. I remember all those moments. She keeps me grounded, she keeps me focused, and she keeps me motivated.
So Dr. Trosdale's mom is finally ready to have her surgery.
Yay.
So yeah, I know.
She's going to be looking so good.
She's going to look so good. Yeah, he's joking that he's going to look like she did when he was born. Yeah.
What does Mr. Trosdale feel about this?
He's being, kind of low key about it so far. He doesn't think he wants anything because he's very much not like Dr. Trosdale in that he does not like blood. Like he can't watch any of the videos. He doesn't like the whole thing. But he's like, whatever will make her happy, sure.
We had a patient, I don't remember the lady who came from Africa. So she texts me all the time. So of course I was like, hey girl, so she didn't tell her husband she came in for facelift. He was mad for 2 days, but now he's in love with a younger wife. I know, she's so cute. She's so cute. She looks so good though. But that's nice.
I know, yeah. It's hard to stay mad when your spouse looks amazing.
I know.
Because Jessica was a little bit more of a bruiser and a little bit oozier during surgery, I decided to put drains in. What drains are? They look scary, they look crazy. They're little tubes which help drain blood or any fluid that's under the skin. This is important because it's better out than in, right? So if I can keep that blood from being under the skin, then it won't develop and it will be less bruising and will actually help her recovery down the line.
Yeah, so Carl, listen, I saw that post that you put on there the other day of that woman that you just recently did. And I was like, oh my God. And all my friends are just calling me and talking about it. And I'm like, I'm next. The way she was talking about just do it, I'm next, Carl.
You're next?
It was just amazing. Because they were thinking, wow, this is Photoshop, right? I'm like, no, this isn't Photoshop. This isn't AI. This is Carl Michael Trosdale. So I was just so excited about it.
I mean, you've been talking about this for a long time.
Yeah.
I mean, last time we talked about this, you kind of got cold feet.
I got a little cold feet, but before you were telling me that, I really didn't need anything. So now I'm at that place where I'm thinking, but you know, I'm approaching 68. I'm thinking I'm needing a little something because
nobody needs anything. But
well, no, nobody needs anything, but I want. I mean, that sister the other day, Carl, was amazing. So no, I'm ready. I'm ready.
I mean, we might be able to do a little something. Let me see.
Yeah, just a little.
I mean, basically, you gave me this neck.
Uh-huh.
Maybe something. We got to make sure you're like, you really are serious.
I'm serious. Yeah, I'm serious. I'm 99.99.
You saved my life. You know, I mean, you don't even know that. I was in such a deep, dark spot and I didn't know how much longer I was gonna take it. It just, you know, I don't think people always look at the superficial side when it comes to plastic surgery. And honestly, it's given me my confidence. And I mean, I told them earlier, you know, I have to do the work as well. I mean, mentally, you can't let those incessive thoughts like completely control you.
So Jessica came back and I almost started crying because I walked in the room and she literally says, "Doc, your surgery saved my life." I don't take that lightly. When a patient says that, and I've saved lives before doing real medical treatments like airway surgery, things like that, where a person can't breathe and then I come in the room and then they're breathing. But doing that with plastic surgery is so powerful. And she's not being hyperbolic, she's serious. It means so much because people minimize what I do. I'll meet people, "Oh, you're a plastic surgeon. Oh, that doesn't mean anything. You could be a real doctor." I've had other doctors tell me I'm not a real doctor. But it reinforces the idea that it really is about taking care of a person in totality, not just the face. It's the whole mental aspect. She's doing the work with therapy, but we're also helping her with things that don't go away with therapy. Let's be honest, you could do the most therapy in the world. If you still are depressed about the way you look, might need a little bit of help.
It has been 3 months since I've last been here. Amazing. Peaceful, just excited for the future.
Oh my God,
And
yes,
it's amazing.
you're back.
I told him, it's like going to the grocery store is fun now. I
had a patient and she's like, I go to the mall now for no reason. What she said, I go to the mall for no reason at all.
Yes.
So you are the perfect example. Like I try to tell people, like plastic surgery is not just about big lips and making people look like tigers.
Right.
It's not not about that. And you know, I had a choice. Should I do head and neck cancer surgery or facial plastic surgery? And that's hard because it's like you want to save people's lives. So you telling me if you feel like this saved your life, one, it's validating. It feels amazing. The mental health aspect that goes, it's not the only part of plastic surgery, right? It's not just the surgery, it's the other stuff that you have to do at home, and you did that. People don't think about plastic surgery as therapy, but a part of Jessica's process, her therapeutic journey of discovery to fight her depression, is feeling better about the way she looks. I'm a part of that. And who would have known that when I met her months ago here as she was visiting my nephew, that she would become a patient. Well, let me look at everything because you look so good. So we did our brow lift. The eyes are so much more open.
Oh, I got my eyes back. That's the biggest thing is my cousin, I posted a picture on Facebook finally after like 2 months and my cousin texted me right back and he's like, "Your eyes are back." He's like, because he hadn't seen me yet. And as soon as I seen him, he's like, "The eyes are back."
The eyes are back. We added some fat to your face. We did the face and neck lift. This jawline is for the gods. The scars are already starting to kind of fade. You always have had like a bit more of a pink complexion.
I have.
So it's gonna take a little bit more for these to kind of go full fade. But you know, your skin is kind of more pink anyway.
It is.
So it blends in really nicely. It looks really natural. Under the chin, it's healed. It's still gonna take some time to unswell. But you still swell.
Because this side feels a little like it hangs down. Well, it hangs down a little bit more. Well, you know, it's
like the 1 or 2 millimeters. Listen. Even if we're posting a beautiful photo, in that moment, we're thinking thoughts. We have feelings and we have insecurities. That's okay. That's okay. We're working on them. We work through our problems. And I'm there as a tool to help work through an issue that a person might have. Very similar to a dentist or a cardiologist. It's a different type of thing.
I know how I carried myself before, and I wasn't confident, it was just, timid. It's changed everything, because I think when you feel good about yourself, you just feel different. You treat people different, and not that you shouldn't treat people different, but I think sometimes when you don't feel good about yourself, you don't realize that that's projecting on your outside. And sometimes that's how you are actually treating others, because you don't feel good on the inside. So I see waiting for my kids to have children so I can be a grandmom and just enjoying it. I feel like myself again, 100%. And I know that aging's gonna happen, and that's part of it, but I can take care of myself and just do the best I can to maintain what I got. And